what we had been able to investigate initially was corroborated elsewhere. And I'll give you a brief rundown of how that happened. We had intended to actually release the 10 of them on the Friday, but because we had a positive sample on Friday, all of them were kept back one more day, and he remained there after Saturday. The other 9 persons were released from the quarantine on Saturday around midday because they had been negative, and because we were satisfied that with the investigation the risk that they had was practically it's never going to be non-existent, but it's minimal to a very, very low risk, and that's the reason why they were released. So to recap, because you will recall that we have started seeing that people coming from the cruise ships would routinely have been there for weeks, months, 70 plus days. So this is the first group that arrived. You will also recall that when this cruise ship arrived on the Saturday, we did not at health were made aware until the Friday evening before they docked. They docked early Saturday morning. We had also placed in our in terms of this case is that the 10 Belizeans that arrived on that cruise ship actually came from 7 different cruise ships into Rhapsody of the Seas. And the 7 cruise ships that have been named from where these 10 people initially arrived are Harmony of the Seas, Symphony of the Seas, Emperor 23rd. So that means that people, the 10 Belizeans at least, had a period of 11 to 16 days on board that ship. That's when you start counting for this particular cohort, because they came from different ships. We have now been told that on one of those 7 oases of the seas there had been identified cases of COVID-19. In the particular case of the young male that turned out to be positive, he had been symptomatic, and this is his words, with flu-like symptoms towards the end of March, during the first week of April, with a rapid test. And he was tested for other influenza viruses, and those were negative, and that's why he was considered and classified as a negative case for COVID-19. When we went back to review the data from our lab, the lab did indicate, you should note that the lab has a threshold. It has a quantitative value. You measure it, it needs to have at a certain level before you're considered positive. This person was minimally positive according to that threshold, which means that he seems to be towards the end of any infection he may have had. And there is also the possibility that he could have been what we call those persons that take a long period, ended period. And recall from even our own cases in Belize, we have had people shedding viruses close to 5 weeks or a little bit more. So that could be the particular case with this person. He will be swabbed again later on this week to determine whether he has seroconverted. We are not going to wait the full 14 days because it would seem that we captured somebody who was in the latter part of any infectious process. As we said, he is, when he arrived and up to when he was diagnosed, he has been an asymptomatic person. So there are 9 persons who were released from the quarantine facility, had minimal to no contact, and because they were at the end of that period, we were satisfied that that had they were in point of fact negative. From the other 2 cruise ships that arrived on Sunday, May 31st and Monday, June 1st, a similar exercise is now going to be conducted in terms of trying to determine where all the Belizeans were prior to them arriving on that cruise ship that brought them here, or whether they had in point of fact not been changing ships along the way. And this is important because when you're bringing people in on board a ship, that's where possible cross-contamination is going to have, because you're bringing people from different pools. So this is not one single cohort, and it's not one single group of people that were sailing out at sea for an extended period. It's people that came and mixed at different intervals before they actually came into Belize. That's that in terms of patient number 19, and we feel it's an isolated case, we feel it's a contained case, and this underscores, again, going back, the relevance and importance so that people can understand why we are pressuring for people coming from outside to go under mandatory quarantine for the time being. We should be aware also that the repatriation process has started. 5 Belizeans arrived on the flight last Friday, and more anticipated to arrive this coming Friday. Based on the experience we have had with patient number 19, we have decided at the Ministry of Health that we are going to shift around the testing process that we are doing. We are no longer going to be doing random testing in the general public in asymptomatic individuals. We're going to shift it around. We're going to still continue to test anybody who has flu-like symptoms, anybody who has influenza-like illnesses or is hospitalized for severe acute respiratory illness. But we're going to now be testing people once they start arriving in Belize and prior to them leaving the quarantine facility. We can also make a note that families have started arriving through the Guatemalan border. 2 different families arrived last week Friday. These are people who had medical conditions, and so they were allowed to go and quarantine home. And we have had notes of people who had sought medical care outside of Belize and have died outside, and we are in the process of also bringing them, the cadavers, back home. And we are aware of the people coming in through the northern border and are now going to start going into different facilities. For now, the hotels that we are using, we had mentioned Cocolquín in Corozal. Princess is going to be reviewed for potential use later on in the week, but Biltmore and Radisson have some of the persons under quarantine. Lamanay Landing in Orange Walk, we're looking at a couple of hotels in Cayo and a hotel in San Pedro that we will routinely be using. Before I jump into the questions, because I am assuming there will be lots of questions that will be popping up, is for those persons who are filling in the repatriation process form, we are asking, at least from the Ministry of Health standpoint, that when you cite the medical condition, and that being the reason why you feel you should be quarantined at home and not in a hotel, you will have to provide medical evidence for that. Because we are noticing that the first list that we got from people wanting to come from the US, almost everybody is citing some medical condition as to the reason why they can't go and quarantine in a hotel. People are saying, I am diabetic, I can't go and quarantine in a hotel. I have high blood pressure, I can't go and quarantine in a hotel. That alone is not going to be a criteria for you to be isolated or asked to be in quarantine at home. You would have to show that you are acutely ill, that you were seeking medical conditions outside of Belize and then became ill or are still recovering from whatever you went to do outside of Belize, and that would be a condition where we would consider placing you in quarantine at home. Because it's close to 600 Belizeans. If we start allowing everybody to go quarantine home, that becomes a nightmare in terms of us tracking people across the country versus people being quarantined in a set place, such as a hotel where you can set up all the mechanisms to have a better control of what's happening. Not that we want to control persons, but I hope that now you can appreciate why special conditions are required for that. So I will jump right into the questions that, as I said, I think are going to be a lot. And again, I'll beg your indulgence. I will only be able to answer questions related to health because I know there's lots of things that keep popping up. We are only responsible for the health component in that light. It says our worker is going to be tested now that the case is at the quarantine facility. I assume you're talking about the workers at the Radisson. Not necessarily, because what we're going to do, they are going to be considered frontline personnel who can be randomly tested, or if they start to show any sign or symptom, then they would be tested. Because the exposure to people at the different hotels in quarantine facilities is minimal. People staying at the hotels are not allowed to go around meeting anybody else. They're not allowed to go to the swimming pool, to the restaurants. Food is delivered to the door of their room. So that's not necessarily going to be a high risk contact in that light. It's considered to be a casual contact, if you will, so we are not routinely going to be testing the entire staff, for example, at the Radisson where the last case still is. Can you comment on Belize going 53 days without a case and then one appearing? What is to stop us from ending like Suriname, which went 44 days without a new case and now has 130? Draw comparisons between Mexico, Guatemala, and Brazil. I am not too sure that the cases in Suriname are from Brazil. We were actually in discussions with a colleague from Suriname. I don't think they even have a formal border crossing Suriname and Brazil that's as fluid as perhaps our borders can be. So I think the comparison would not be allowed to be done like that. With Mexico and Guatemala having increasing numbers, that's something that we need to follow very closely. But again, if you go through a process of allowing, for example, the Belizeans repatriation process through the routine, regular process of following the protocol, you minimize the exposure for people coming to Belize. It's the people that are doing the illegal situation that can put us in a bind, because that's not going to come to the light rather quickly. But what's happening in Suriname can happen just about anywhere. You'll notice that the dynamics of COVID-19 changes rather quickly, the evidence changes rather quickly, so that in point of fact you can have a case that goes undetected and over the next 2-3 weeks you have 15, 20 and that balloons. That can certainly happen if you are not careful to be able to protect against that. Vault Healthcare is using saliva testing kits. Is this something you can use to help us with rapid testing? We'll have to review the data. There's, as I had mentioned the last time, now more than 70 rapid test kits out there that are being used, some more than others, pending different validation for specificity and sensitivity. So those are things we are always looking out for as a potential situation that we can use in Belize. We are also in the process of procuring, other than the PCR tests that we are doing, to do PCR tests to gene export machines. We already have 2 gene export machines in Belize, one in Belize City, one in Belmopan, that should be routinely used for tuberculosis. So what we are now in the process of procuring is the cartridges for doing tests using those platforms. The turnaround time is quicker. You can get a result in 30 minutes. It's a PCR test from nasal swab. It doesn't require the process of extraction. The situation there is that you can only run 4 tests every 30 minutes, and we are procuring 2 other machines, one for Orange Walk and one for Dangriga, so that will allow a quicker turnaround time at the different regional hospitals. And we are also assuming that they are not going to have that high a number, so that you can run 4 tests every 30 minutes. Can you discuss the fast rising numbers of cases in Chetumal and the significance of this for Belize? Second hottest zone for COVID infections in Quintana Roo. Yes, we noted that. I think they changed color through the weekend, only behind the Cancun area. That's something that we have to look at closely. I think this also underscores, and we are trying to get the Belizeans that are in Chetumal to be moved as quickly as we can back into Belize, following the due protocols. Mexico, as you note, opened most of what they had shut down on June 1st, which was last week Monday, and the report as of Sunday, the entire country was in a red zone, if you will, because of the escalating numbers just about everywhere. Some state hospitals referring that they have been now overwhelmed with the amount of cases that they have, and those numbers in the new projections for Mexico continue to increase, and it doesn't seem that Mexico will peak now. They have changed that date to the first week of July, with a tapering off of their curve as late as October. So that's something that we need to look at closely. The other people that came in with this positive case, are they going to be tested again? And they have left the quarantine facility, They don't need to have two negatives. That's not the routine protocol, simply because they were not positive. So that's not what it would happen. So they left the quarantine facility already. Can you discuss the case of the 300 fishers caught by Gladden split fishing illegally in the reserve on Monday morning? Where are they quarantined? In Dangriga, as far as I understand, they are at the Russell Chiste Garcia Stadium. And are they being tested for COVID-19? They would be tested now. Again, the protocol would not have asked that we test people once they are caught, rather before they leave. Or wherever they are released to the police, or wherever that legal matter is going to be. I don't know if they have been tested, but the new revision that we have done would mandate that we test them, still keep them the 14 days, and we test them 14 days later to be released to the police or wherever they are going to go. Yesterday, WHO put a note stating that the chances of asymptomatic transmission is low, and today they walked back on that. Can you discuss the public health perspective on this? Yeah, I initially read what the newspaper articles had said, and I don't routinely read newspapers. I went back to listen to what the WHO technical expert had said, and I don't know that it said anything that had not. I think it's kind of misinterpreted in a way, for if you read just the headlines of the newspaper. From a technical standpoint, obviously, and we had said in one of the discussions we have had here before, if you're an asymptomatic person, because you're not shedding that many viruses, it is less likely that you're going to be passing an infection than somebody who is ill, sneezing and coughing everywhere. So your probability of passing a virus, of course, is significantly higher, or higher than somebody who is not having any sign or symptom. Actually, that's the reason why face masks are routinely advised to be worn in public places, because if you're an asymptomatic carrier, your probability of passing the infection on is minimized by wearing a mask. So I think that's what she intended to say. That's what the evidence suggests, but it doesn't mean that you can have a wealth of asymptomatic persons in a given area and you're not going to consider the prevention measures that we have had. If you zone that to where we are in Belize, out of the 19 cases, the majority of the cases have been asymptomatic. If you will recall, the majority of patients were actually picked up because of contact tracing, not because they were showing signs and symptoms. So that's important that we, whatever information is coming from outside, based on the experience that we have had, is seeing how that influences any policy decision or any protocol change that you have to do. What is your opinion on the reopening of school? Do you think it's safe, especially for the small children? That becomes part of a new norm, and I know people don't like to hear. I mean, I've been told that people don't want to talk about a new norm. Regardless of what you want to call it, you might choose a fancy name, if you will. We have to understand that there are new conditions, if you will, under which we're going to have to carry on. Vaccines might not be available to the next 18 months, for a context like ours. So, school has to open. We have to take the necessary precautions. We have to look at the hand washing technique, even if that gives you an opportunity maybe for the children to learn to wash their hands, learn to be disciplined in terms of wearing a face shield, a mask, whatever it is that we are going to do, the physical/social distancing, those things, the school might give you the opportunity then to ensure that we become, if we are not a disciplined society, to make sure that those things are carried through on a daily basis. So I think it's an opportunity. We did indicate to Ministry of Education that one of the key potential situations is that maybe schools should reopen sooner, because we still think at the Ministry of Health that you're going to have a potential second wave once you have exposure to outside, but also understanding that the flu season routinely happens towards the end of the year. And remember, if you have flu going around and COVID-19 going around, you won't be able to perhaps make a differentiation if you have a vast amount of cases. So that hopefully whenever the flu season happens, even if you don't have COVID-19 in the picture, you have closed off your school year and then, or your school semester, so that you're minimizing that potential exposure to others. In terms of those students from across the borders who attend classes here, what is your advice to our Ministry of Education in how we treat those students when school reopens? I don't know what Ministry of Education has decided in terms of that, but I don't see that it would be any different from any persons coming from Guatemala. I mean, from now until school opens, that's what, 7 weeks, things could change. But if you ask me right now, it doesn't seem that there will be a condition for the people who come from across the border to come into Belize on a daily basis and go back out. And sometimes I know in Benque, I think they actually go back for lunch and come back in the afternoon session. So that's an increased risk. So for right now, it doesn't seem that that is something that can be worked out. If that's being considered, we have to find a mechanism of how that will happen in 2 months from now, because I think today is what, June 9th. 2 months from now is when school opens. So we will have to review, again, this changes. I mean, if you have some kind of screening mechanism between now and August 10th, then that needs to be factored into your process. Considering small number of persons being repatriated and after what has recently happened, will you reconsider your present strategy and test all persons arriving home? Yeah, I have just said that. It may not mean that everybody who arrives at the airport, let's say on Friday, 80 people arrive on the airport. Not everybody who arrives will necessarily or may necessarily be screened upon arrival at the airport. But if you're putting all of them in a hotel, for example, you can space it out, maybe do some on the day they arrive and do the others the following day. But the intention is to screen them upon arrival or as close to the time they arrive. And then screen you at when you're at the 14 days before you're released from the quarantine facility. The testing upon arrival will also now be extended to people who are sent to quarantine home. So even if you have cancer, recovering from a surgery, whatever it is that you are outside, you will also start to be swabbed as we move along. Is it wise to contemplate opening the airport given the economic pressure from the BTA and stakeholders? From the purely public health standpoint, because I think you're asking me an economic question, there have to be adequate mechanisms in place in order to minimize, one is to minimize the risk, and one is to ensure that the population that is in Belize remains protected. That's a work in progress. I have indicated to the Oversight Committee that currently, as we speak, we don't have a straight answer as to how that mechanism would happen. And it's the same issue that other Caribbean island countries are having. There is no straight answer. And so as they are opening up, we're looking at lessons learned. And whenever we have a straight answer, or as straight an answer as you can get, then I think that will be tabled because people will need to know what the process and protocols are as we move along with opening up the airport. How common are false negative tests? It fluctuates, depends on what you use, and that's where you can have a nightmare. False positive is not too much of a concern because at least you're getting flagged and you go and retest that with a PCR test, if that would be the case, if you're talking about a rapid test. A false negative, however, can be a nightmare because let's say it's 10% of our population. You have a flight, let's say it's the airport, and you have 180 persons, or out of 100 persons, and you have a 10% false negative rate. That means that 10 people are simply just going to be negative. You assume they are negative and they go and interact, and that's where you can have a potential problem. That's actually what you are try to safeguard whenever you try to have a test that has a better sensitivity and specificity. You don't want to be misled by the false negatives. And we do know that some of our Central American counterparts have experienced that with some of the rapid tests. Can you say how much hours can someone be out there wearing a mask, and is it healthy for our breathing? I had used the analogy of surgeons or people in surgical theaters that can go 12, 14, 16, 18 hours wearing a mask, assuming you're not doing strenuous activity at least. So I don't know that there's a specific time period that would warrant it to be unhealthy. Or at least for the people out there in the public, I don't think you're going to be there doing strenuous activities all along. Please address the issue of people not wearing masks properly. I see 95% of individuals having their nose not covered. We are going to be presenting also a note to the NOC for next week Monday in terms of a position paper for from the Ministry of Health standpoint as to where we think a mask and when a mask should be worn. When is perhaps the overarching situation. You will notice that WHO has finally put out some statement to indicate that there's potential benefit. But again, the very key things that I highlighted maybe 2 months ago to indicate that when you wear a mask improperly, when you're touching it frequently, those can be, and people getting a false sense of security, those can be detrimental against the consistent chronic use of a mask. So I think once you have a position paper as to when it should be worn and under what conditions, then we'll be able to have further discussion in that. But a mask must be clearly covering your nose or your nostrils, not the entire nose, the nostrils at least, and the mouth area, firmly secured around your face. But you see, even in terms of that, you will also read articles that talk about people who have a mustache, people who have facial hair. Those harbor lots of bacteria and can potentially or subsequently harbor COVID-19 viruses. So even that is considered to be part of the newer norm, the new probability of COVID-19 with less facial hair. Says, can you comment on the situation at the western border where the head of Guatemalan's customs has died due to respiratory failure and is being investigated as a possible COVID-19 case? I have seen the note. I did not see it say he died of respiratory failure. The note says that he died of a seeming heart condition, but because his death was so sudden, and they're thinking it's a myocardial infarction, that he was going to be swabbed and I assume tested for a COVID-19 case. That's what I know. I have not seen the official report that in point of fact he has been considered to be a COVID-19 case. There's also another worker there who was tested positive. We got that note yesterday. We also have not gotten that confirmation note. As I understand it, they're actually not testing them there. They're just doing the swab and sending it elsewhere. But we are seeing lots of that start to come up, but we have not seen any confirmation that in point of fact anybody at that border station point has turned out to be a positive case. Can you comment on the significance of those cases for public health in Belize? Well, as far as I know, the border would be closed, so I don't know how much of an interaction Belizeans would be having with people at the border entry point. If at all, it would be the people who have started to come back, like from Friday of last week. It would be interesting, or we would need to know where he potentially got the infection from, and also if you're just crossing the border entry point and you're handing your passport on to somebody, so that's a casual contact. If your exchange of words is minimal, whatever happens there in a short period of time, that would be considered as a casual interaction. I don't know that from the public health standpoint we would routinely be that much concerned with that situation. I believe those are all the questions that we have. I don't see any other question here. So that's what we have for now. We are going to be reviewing, as I had said, how the protocol in terms of testing happens when people arrive. We are going to be we're still working with full participation with Foreign Affairs and Immigration in terms of the repatriation process. As I had indicated, I would really want that people are truthful in terms of what they are putting on their forms in order for the repatriation process. If there's any doubt in terms of what happens, we at Health then are going to make a determination once you arrive whether you in point of fact are acutely ill that you would have to go home or to a health facility, or whether you have to be quarantined at a hotel. So there's a possibility that all those that have listed in their repatriation notes a health condition, we will be requesting medical evidence or a medical summary of what it is that you are doing outside, so that can help us in our determination. We unfortunately cannot just rely on what some people are sending us, like a photo of the prescription. And if it's a hypertensive drug you're taking, that is not going to be a reason enough for you to be quarantined at home. I think it also makes, I hope you understand that it's easier if people are able to fly whenever they're able to fly, or come across the border, and going to quarantine in a hotel, that's easier and for everybody, and there's a higher probability that you're going to be allowed to come quicker, because once you have submitted and we have agreed that you're going to be able to go quarantine home, we need your address. We need to go and verify where you're going to quarantine at the facility. Speak to whoever is going to be in the same home, if you're going to be sharing a home, to do a minimal education, an educational process that minimizes your risk. And we also need to determine how you're going to get from the entry point, if it's at the airport, to where you're going to go and quarantine. So all of that has to be clearly articulated. We need to be having a clear sense of how that is going to happen before you're able to sign up from Health, so that people can just come into to the country. Once we have more information in terms of where we are going to go, but that's where we are now. Thank you very much for your questions. One other piece of information I need to clarify. We did get asked why we put out a release that, in the view of some, did not include much information on Friday. Two reasons for that, and we go back to where we were in cases in March and April. We did say we need to provide information in real time to persons. So, because we don't want it to be misguided, and we are not inventing any case here. So that case is a reactive case, it's being treated as such. So we needed to get that information for you on Friday. We did not have all the particulars that I'm able to share with you, so I could not have possibly put out a press release that has all the information that I am now sharing. So you need to do your due diligence. We did have to tell you we have a case, so that you are not getting it through some other source. And once we have further information, we have started the clarification process on Saturday, and voila, you have gotten the full details of that particular case today. And that's how it's going to be as we move along. So thank you very much for listening, asking the questions, and do ensure that those situations that we have kept talking about, physical distancing, washing your hand, avoid touching your face, wear a mask properly, those become part of the new routine in our daily lives. Thank you very much.